Hello everyone, today we are going to talk on something called as HbA1C, which is an average sugar of last 4 months, and a new concept which is coming out, that is time in range, right? Now as we all know, HbA1C is an average of last 3 to 4 months of the blood sugar levels. We usually prefer doing it by HPLC or boronate affinity methods, because the efficacy of this line of treatment, this line of test, this type of test, method of test is really good. Now what we are trying to do here is make the HbA1C actually helps us to give an average of last 4 months, how the sugar is behaving. Based on that, we screen it for to rule out pre-diabetic patients also, because if we see that the HbA1C is between 5.7 to 6.4, it helps to prevent diabetes in future and coming years. But in diabetic patients, if a patient comes to us with a very high HbA1C, but current sugars are normal, it shows that there is a lot of fluctuations in his sugars in the last 3 to 4 months, which may make him land up into major complications. So we intensify our treatment and inform them about this, that this is what we are doing with you. Now there is a new concept called as time in range, which actually helps to know how many hours in a day your sugar is actually falling in range between 70 to 180 milligrams, which helps to intensify the line of treatment what we are giving to our patients, right? So we do this with the use of some glucose sensors, wherein we apply those sensors on the patient's body, and it gives us an average around 75 readings in an entire day in different timings. So it gives better insight. And if we map it with the current diet what the patient is having, we can make the patient understand and aware how the sugars are behaving while eating what, and the patient becomes more aware about his disease. So this time in range is something which is more intensified, and which helps to control the sugars even better and to prevent complications. Vis-a-vis where you see HbA1C, which helps to prevent complications with an average sugar of last 3 months. The only lag effect that we see with HbA1C is if patient is coming after a long follow-up after a year. If we do an HbA1C during the follow-up, we can see an average of last 4 months only. So the detailing of his sugars is very poor, wherein if the patient is using sensors every month, so we can analyze every month, even if he's not coming, but he's using sensors every month, we get a complete compiled data about his sugars, and we can manage it very nicely. And these are the parameters which helps us to prevent complications like heart problems, kidney issues, eye problems, liver issues, and stroke and paralysis. And we see there is a very good form of treatment that we can offer to the patient, and we can prevent complications in these cases. Also, when we talk about pre-diabetic patients and pre-diabetics, also we can prevent diabetes in future by using this method of time in range, which gives us a better insight of his sugars, and the patient can intensify his exercise, intensify his diet. Based on that, he can do it on his own. So we don't have to guide the patient for that. He can do it on his own without medications. But the point here is, even with the use of time in range and HbA1C, we cannot reverse an established diabetic patient. We can put them into remission, wherein patient has to take certain medications, because the only purpose is doing that, not stopping medicines, is to preventing him from landing up into major complications, because there are a lot of progressive problems that is already started after getting diabetes, which doesn't stop even after even if the sugars are well controlled. So the patient has to be on certain medications to prevent complications, and also to control the sugars well. But if we can manage the diet and exercise, we can think of reducing the doses, putting him on bare minimum medications, which we usually use for pre-diabetics. And vis-a-vis, we have to take care of his complications also, because usually patients target only the sugars. They don't look at the complications they are going to face in future. So we have to take care of the sugars, sugar control, and the complications as well, both hand in hand. It's not just about sugars, right? So by this you get a better understanding how we can make use of these tools like HbA1C and time in range to understand the disease progression and to understand the prevention of diabetes, how we can do it. Thank you so much.